Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, then what are the complications of nephrotic syndrome? So the main complications of nephrotic syndrome include, first and foremost, the patient will have venous thrombosis and the patient will have pulmonary embolism are the main complications of the nephrotic syndrome. Then the patient can have these pulmonary embolism and the venous thrombosis are mainly due to there is in the nephrotic syndrome there is urinary loss of antithrombin 3 is seen in the nephrotic syndrome along with low plasma volume, and there is increased fibrinogen is also seen in the patient. Then you will see presence of hypercholesterolemia is seen, and this hypercholesterolemia will cause atherosclerosis or xanthomata can be seen. Okay, hypercholesterolemia will result in atherosclerosis and xanthomata is deposition of cholesterol over the skin is called as xanthomata. So hypercholesterolemia means you will see that there is increased levels of total cholesterol will be increased. There is increased levels of very low density lipoproteins, and low density lipoproteins are increased along with triglycerides. And also you will see that there is decreased levels of high density lipoproteins are seen. In the nephrotic syndrome, the patient will present with hypovolemia, and also renal failure can also occur. There is also loss of specific binding proteins are also seen in nephrotic syndrome. These binding proteins like transferrin is lost, and also thyroid binding globulins are also decreased in nephrotic syndrome.
thank you and thank you for watching.